Let me just make this statement. Breast cancer can be cured. You're shocked. You're surprised. You're astonished. Hello my loves, welcome back to my YouTube channel. If you are a returning subscriber, thank you for coming back to watch my videos. Thank you for your subscription. Thank you for your likes, your comments, your shares. I am super grateful. Then if you're seeing my face for the first time, you're watching my videos for the first time, I hope you subscribe to my channel. Subscribe now. Just subscribe. Subscribe is free. Share my videos with your family, your friends, your loved ones, and your well wishers. So today's topic will be breast cancer, and I'm going to talk on this topic with all the seriousness in me. In fact, that's why I'm wearing my scrubs, many money, so that you will know that this is very serious. This is not something we should joke about, honestly speaking, because the number of breast cancer cases I have seen in the past 3 to 4 months is alarming. Like on an average, I see at least 3 breast cancer cases a week. So I am not here to joke. I am here to tell you about breast cancer and how to prevent it, how to achieve cure when it comes to breast cancer. So by way of definition, I'll define cancer basically as an abnormal growth of cells. So that's like the layman, the most basic definition of cancer, abnormal growth of cells. So breast cancer occurs when this abnormal growth of cells occurs in the breast, and it can either involve only one breast or the both breasts, but most of the time it starts with one breast, but then it can spread to the other breast. Now, how does it start? Basically, this cancer now starts from the milk ducts in your breasts, and there are basically various forms of cancer, especially breast cancer. Now, in the early stages, the cancer is like confined to its point of origin, and eventually, if care is not taken, or if no management protocol or no intervention was made, it will spread to other part of the breast and then become invasive, and ultimately it can spread to other organs outside the breast and become metastatic. Simple, easy peasy, right? Now, what are the risk factors? What are the things that would increase your chance of coming down with breast cancer? Note, I said increase your chance, not directly cause. These factors can be factors that are within your control, factors you can change, and it can also be factors that are not within your control, factors you cannot change. And then for factors that are not within your control, you cannot do anything about it. The most important of them all is female gender. Yeah, I know. So being female automatically increases your chance of having breast cancer, and statistics have shown that 99% of breast cancer cases occur in females, for obvious reasons. I mean, we have more breast mass than the males, and then only 0.5 to 1% occur in males. I have actually seen one male with breast cancer, and this is not even they want to say, oh, nature is cheating us, because the men are suffering prostate cancer too. So being female automatically increases, and there's absolutely nothing you can do about that. Then another one is advanced age. Being advanced in age, ideally people or women older than 40 years of age are at increased risk of having breast cancer than younger females. But this doesn't mean that breast cancer doesn't occur in younger age group. There are cases. I have seen a 28-year-old female with breast cancer. So it also occurs in younger age group, but it occurs more in the older age. Now, another one that you cannot change is family history. Now, a family history of breast cancer increases your chance of having breast cancer. So these are the factors you cannot do anything about. Another one is early age at menarche, early age at menstruation. So if you got your periods very early in life, you are at increased risk of having this breast cancer. Or late age at menopause. So if you attain menopause very late in life, you have increased risk of having breast cancer. These are things you cannot do anything about. These are things you cannot change. Now let's go to the factors that you can change, factors that you can modify. Obesity. I always talk about obesity, and I have explained in my previous video what obesity is and the body mass index that you would have that would mean that you're obese. Now, obesity, as I have earlier said, is a risk factor for so many non-communicable diseases, and not just cancer, hypertension, diabetes mellitus, a whole lot. So attaining or maintaining a healthy weight would solve roughly maybe about 40% of your problems in life. Yeah. So yeah, obesity. And that one is alcohol and cigarette smoking. I also mentioned this in the hypertension video. Excessive consumption of alcohol will increase your chance of coming down with so many non-communicable diseases. You have to do everything with moderation. What, like, even the Bible said it. Moderate your alcohol intake to little or nothing. Then you see the one of cigarettes. Cigarette has no benefits. Tobacco products, cigarettes, shisha, anything that involves sniffing, inhaling, as far as it's going into your lungs, your nostrils, please avoid it completely. It has no benefit for you, my loved ones, none at all. Now, another risk factor that you can modify, I'm saying this and I'm blinking my eye for obvious reasons, is late age at first pregnancy. So now, late age at first pregnancy is a risk factor. Another one is hormone replacement therapy, and this is usually seen in people in the postmenopausal age group, because there are so many effects that menopause cause and menopause can bring, and hormone replacement is usually one of the means of managing these menopausal symptoms. So hormone replacement therapy, yes, can increase your chance of coming down with breast cancer. Now, irrespective of all these risk factors and that I have talked about, it will interest you to know that about 50% of cases of breast cancer occur in women that only have two risk factors, being female and age greater than 40 years. That is the only thing you would see in them. No family history, they're not obese, they're not on hormone replacement therapy, but they are just female and are above 40 years of age. Now let's talk about the signs and symptoms of breast cancer. Usually the commonest sign and the earliest sign a woman would notice is a breast lump, right? So you may be going about your normal activities, probably having your bath, and then you just come across, oh, there's a breast lump somewhere. And then the thing I have noticed is we have a very poor health seeking habit that we notice this lump and ignore it. Once you have noticed this lump, the best thing will be to visit a doctor to examine your breast, remove the lump, and send for a special test called histology. Another sign you can see is that you may have skin changes. You may just notice that the skin around your breast is different, is abnormal. Either it is puckering, like retracting, having this dimpling effect. We call it peeled orange, meaning that it looks like the peel of an orange. You know how the peel of an orange is with all the dimples. So that is how the skin of your breast will look like, and like, it's not normal. Or there are other forms of skin changes you may notice that is happening to your breast. Or you may have abnormal nipple discharge. So the discharge could be bloody, it could be, but something abnormal. You're not breastfeeding, you're not lactating, and you're having nipple discharge. Is something very worrisome, right? And you may have nipple retraction. So your nipple may just retract, like go inside. These are like common signs that will tell you something is definitely wrong somewhere. And other signs and symptoms that you may experience that would mean that complications have set in, meaning that the cancer has spread, would be shortness of breath, which will happen if the cancer has spread to your lungs. You may have bone pain when the cancer has spread to your bones. You may have confusion, altered consciousness when it has spread to your brain. It can spread to your liver. You have yellowness of the eye. So these are like things that can happen. But we see when you start seeing these symptoms, it will mean that the cancer has spread, it has gotten really bad. Now let me categorically state that not all breast lumps are cancer. Please Please relax, don't be scared. Not all breast lumps are cancer. In fact, most breast lumps that will occur in the younger age group are benign breast lumps, maybe from fibroadenoma, benign phylloides tumor, but they are benign, not cancerous. This is why you have to visit a doctor, a surgeon, to remove this lump and send it for a special test called histology. Histology will prove if this lump is cancer or not cancer. Now, you may also experience lump in your underarm. So when examining your breast, you also have to like examine your underarm, and you may feel like lumps, like, you know. And once it has gotten to that stage, once you start feeling lumps, it means that this cancer has spread to your lymph nodes. And the common lymph node this cancer spreads to are the axillary lymph nodes. Complications usually come when this cancer has spread, when this cancer is in advanced stage. This is when complications would come. So let's talk about the prevention and the control of breast cancer. And let me just make this statement: breast cancer can be cured. You're shocked, you're surprised, you're astonished. Breast cancer can be cured only when detected early, only in the early stage. This is why a regular self-breast examination is important. And you don't need special equipment to examine your breast. You can do it while taking your bath. You raise your arm, you just feel all the quadrants of your breasts and search for lumps. As you're feeling it, you feel your axilla, search for lumps, and it will not even stop at early detection. Early detection and prompt management, right? So even if you palpate and you feel your breast and you see that, okay, there's a lump, and you don't do anything about it, you will not achieve cure. But when you notice that there's a lump and you act immediately, you visit a doctor, the doctor would remove the lump, send it for a test. The test will reveal if it is cancer or not cancer. If it is cancer, you'll be placed on medications called chemotherapy, and you'll be fine. You'll be cured. You go about your normal life. When cancer loses its form of cure is when you seek intervention in the late stages. So when you start seeking for help or seeking for medical intervention when the cancer had spread, at that time, there's nothing they can do. They will probably place you on medications, yes, but it will only be to improve your quality of life until the Lord decides to call you. This is why we always emphasize on early detection, and not just early detection, prompt intervention. So when you see it, when you palpate and you notice it, please visit your doctor. Now, self-breast examination is easily done and ideally should be done just a few days after your period. You can even do it every day. And that thing that can be done for you is a clinical breast exam. And clinical breast exam is done at the health facility by a healthcare professional. So you can go for routine medical checkups where the healthcare professional will examine your breast. If you are 40 years and above, you can go for mammography. So routine mammography can be done for you to check out for any abnormality in your breasts from 40 years and above, ideally. Like, these are methods, these are proven ways that have been put in place for you, so that if these things are done routinely, the cancer will be detected early and you attain cure. I've seen patients that actually detected these breast lumps early, but they did nothing about it. Some of them resorted to herbal concoctions. Some of them went to the church to pray for it to disappear and all of that. Some of them assumed, oh, it is nothing. And the time that you will need to achieve cure just be ticking. Time is of the essence when we are dealing with cancer, not even just breast cancer. Cancer. Delay is dangerous. What are the forms of managing cancer? Breast cancer. Breast cancer can basically be managed by 3 main interventions. So surgery, 1. So the surgery can either be to remove the lump or to remove the breast. Now, I have seen patients hold on to their breasts for reasons I know nothing about. I know it is difficult, or it is sad, or it is hard to let go of a body part, but if it can cost you your life, bro, sis, let it go. What will it profit a woman to hold on to her both breasts and lose her life. So it's either you let the breast go or you let your life go. If your doctor examines you and decides that the ideal thing is to remove the breast, please remove the breast and save your life. Another form of intervention is chemotherapy. These are medications that you'd have to receive either before or after the surgery, or even before and after the surgery, to mop up the remaining cancer cells. And the third form is radiation therapy. I am a Christian and I believe that miracles happen. In Matthew chapter 9 verse 12, Jesus said that it is the sick that needs the doctor and not the healthy. So Jesus himself has even acknowledged that when you're sick, you need a doctor. And I would advise, by all means, pray. By all means, commit it to God and have faith that the medication that the doctor is giving you will work. Faith without good works is dead. Heaven helps those who help themselves. So help yourself. Delay is dangerous. Do your part. Leave the rest for God. Wisdom is profitable to direct. I'm not doing this video to put fear into you or to make you anxious. Be anxious for nothing. But I'm just trying to lay emphasis on the fact that breast cancer can happen in anybody, irrespective of the risk factors. So please, let me not catch anybody that will notice breast lump and keep it for months and delay. No one catch you. Whatever abnormality you notice on your breast, time is of the essence. Early detection and prompt management. Thank you for watching my video to the end. Now tell me why you have not subscribed. Why have you not subscribed to this channel? I'm here dishing out valuable content and you just view and go. Subscription is free. I hope you learned something and I hope you share this video with your family, your friends, not just the females, even the males. Anybody can be a health educator at any point in time. So please share with your family, your friends, your loved ones, your well-wishers, even your enemies, so that they can learn about breast cancer. Thank you. See you in my next video. Bye.